important in their critical care.
Thank you very much.
Thank you,
Doc. Thank you. Hi, I'm Chris Tufton, Minister of Health. In 2016 alone, we saw almost 2.9 million visits to our health centers, accident and emergency departments, and hospital outpatient clinics. We're still crunching the numbers for 2017 figures, but we do not anticipate fewer visits. Therefore, as more Jamaicans are relying on our healthcare system, we recognize that there is much to be done to improve our health infrastructure and our customer relations. We're taking active steps to ensure that you visit our facilities, you're comfortable with the physical plant, and that you're treated with the respect and dignity that you deserve. There were some major achievements in 2016-2017 financial year. The government partnered with a number of private pharmacies to facilitate speedier dispensing of medication to patients issued with prescription at the public hospitals and clinics. This is aimed at reducing the waiting time encountered by persons using the National Health Fund operated drugstore pharmacies located at our hospitals. We spent some $350 million on the reduction in waiting time project at 8 hospitals and 6 major health centers, which has cut the time by at least a third for patients waiting in those accident and emergency departments. Clinics were adequately resourced to extend opening hours to 10 p.m. and are equipped to provide additional diagnostic and pharmaceutical services to facilitate persons who have been redirected to those particular health centers. We extended surgery hours in some hospitals so that you wait less time to have your procedures done. For example, the University Hospital of the West Indies extended its surgery hours from 4:30 p.m. to 10 p.m. The extended hours has significantly reduced the backlog of surgeries at that institution. The National Food Industry Task Force report has provided us with a plan to encourage Jamaicans to practice healthier lifestyles, including better dietary practices. The committee was established in 2016, and stakeholder sensitization is ongoing to develop a range of policy options for healthier living. Through the program of the reduction of maternal and child mortality, PROMAC, contracts were signed for design services for high dependency units in 6 hospitals. In addition, services are being undertaken to rehabilitate 4 primary health centers and 2 community hospitals, and testing equipment has been procured and delivered to these facilities. Letters were exchanged with the Chinese for the building of the Children and Adolescent Hospital in Western Jamaica. This is quite significant because we have not built a hospital in Jamaica in the last 25 years. The current fiscal year is winding down, and we were confronted with some of the same infrastructural issues that have compounded over decades. But we have had another active year of building on the gains we have made in the previous year. During 2017, a committee was established to develop a 10-year strategic plan. This process will continue during this current fiscal year. A 6-month consultancy contract has been signed to develop a national health insurance scheme, a commitment made by this government that is now being fulfilled. A report was submitted by the Mental Health and Homelessness Task Force. Coming out of that report, an MOU has been signed with the Ministry of Local Government and Food for the Poor for the expansion of infirmaries with a view to address homelessness and social cases in our hospitals. In an attempt to stem the shortage of nurses, we have added some 300 new posts, and a nurses training exchange program is being developed to expand training opportunities for Jamaicans interested in pursuing nursing as a profession. We are attempting to support primary health care through community involvement, and therefore have launched our Adopt a Clinic program back in November 2017. To date, we have had some 50 expressions of interest from individuals and corporate entities willing to participate in this program. The National Council on Drug Abuse started its marijuana public education campaign in July, and this will run for at least 1 year. This is aimed at discouraging our young people from smoking marijuana. The Mosquito Research and Control Unit was launched at the University of the West Indies, and work has started. To date, 2 insectaries have been established and are now operational, facilitating significant research on how to control that deadly vector, the mosquito. 1,000 community health aides trained by heart to assist in vector control are deployed seasonally to communities to help fight against mosquito-borne diseases. The Ministry of Health has embarked on a number of infrastructure projects which include the upgrade and repair of several hospitals in all 4 regional health authorities. In the area of cancer care, the first of 2 linear accelerator, LINAC, was commissioned at the Caenwood Regional Hospital, with the other to come on stream at the St. Joseph's Hospital in early 2018. In the area of pediatric care, the cardiac unit at the Bustamante Hospital for Children has been commissioned with a number of surgeries already successfully done. As we move to modernize our hospital infrastructure, the United Nations Office for Project Services, UNOPS, has been contracted to review a plan to upgrade the Montego Regional, St. Anne's Bay Regional, Kingston Public, Maypen, and Spanish Town hospitals. In short order, we will launch our Compassionate Care initiative to improve how we interface with patients. This is an important initiative geared towards improving customer service in all our health institutions. Finally, let me mention our initiative in preventative health care called Jamaica Moves. This campaign was launched to encourage Jamaicans to take personal responsibility for their health by knowing their health status, good dietary practices, and engaging in at least 30 minutes of exercise each day. We have been encouraged by the public's participation and will continue this program into 2018. Remember, prevention is always better than cure. This is why the Jamaica Moves program is attempting to change the behavior towards healthier lifestyle practices and so prevent the need for hospitalization due to NCDs or lifestyle diseases. Jamaicans, as we face 2018, let us redouble our efforts to live healthier lives so that we can be more productive and enjoy more moments, more memories, more life. I wish for all of us a healthy 2018. May God bless you.